Hi, I'm Kevin Curtis, and I'm a Director of Clinical Operations for the Huntsman Mental Health Institute, and I'm here to introduce you to our new crisis care center here in South Salt Lake. So come with me and we'll talk about what this facility is. This facility is meant to serve people having a mental health crisis, and it's an alternative to receiving care in emergency rooms. So we're really excited about this brand new facility and really being here to serve the members of our community having a mental health crisis. Most people receive this care in emergency rooms in other communities, and this facility is designed specifically to do it better and differently so that people can have a better experience. So what's neat about this design is that a lot of it came from early conversations with patients. They told us the emergency room is cold and it's hard. As you walk into these spaces, you see that difference of intention. You feel that warm blanket experience. So when our guests first arrive, they're greeted by a friendly reception staff that helps get them oriented to the building and helps them know what to do. We refer to people that receive care here as guests, as an alternative to patients. We really want them to understand that they're here to receive something special and different, and that starts with the language that we use in referring to them. So the first step that our guest takes when they come to our evaluation area is we bring them into a triage room where we're able to take their vital signs, their medical history. Okay, so from our triage area, our folks come back into one of our treatment and stabilization areas. Here, they will immediately be connected into different types of therapeutic offerings that are happening. There might be a recreation or art therapy group around the table, or maybe there's a music therapy group happening. And this keeps people engaged and working on their stability while we have our doctors and social workers see them. We're here on the second floor of the Crisis Care Center where we're able to do things on an outpatient basis to help with some of the things that often go along with crisis, like medical or dental needs. In addition to medical and dental needs, many of our people have issues in the legal domain or with employment. So we also have a legal clinic where we can help people get resolution to some of their legal needs, as well as get some resources for connecting back to employment. Many of our guests continue to have additional support needs once they finish up in our first floor crisis services, and we're able to help them here on our second floor outpatient services area. We offer medication management, therapy, and intensive outpatient services in support of guests once they leave our crisis stabilization service. While most of our guests will be able to get what they need in 23 hours or less in our first and second floor services, some may need a little bit more care, which we provide for them on our third floor inpatient unit. In our inpatient unit, we have 24 individual patient rooms, each with a private bathroom and a full-size bed. In addition, we have consultation rooms and a quiet room where people can engage in individual activities on their own or with their treatment providers. In our group spaces, we have a large activity day room with large windows. In these spaces, our guests are able to engage in group programming as well as other social activities. One additional piece of design that's really important is the inclusion of outdoor spaces for our guests. Receiving care in a facility like this can feel restricting, and having ample access to outdoor space makes the experience so much better and warmer for the person. So in our inpatient space, every wing of the unit has access to an outdoor porch area, and then we have a large outdoor garden space that we can take our guests to have a more broad experience of the outdoors. Since opening in March, the Crisis Care Center has operated at 96% capacity, a clear reflection of the urgent need in our community. It costs $88,000 each day to keep our doors open, and none of this would be possible without the generosity of supporters like you. Thank you for standing with us in the fight for better mental health care.